Good morning, ma'am. For verification only, may I know your name?
Laura.
Okay, ma'am. So my name is Raya, and I will be your student nurse for today. And I'm here today to conduct an assessment to check if you have any problems or abnormalities in your abdominal system. So would that be okay to you, ma'am?
Yes.
Okay, so I'm going to start by inspecting first your abdomen. So let's expose the abdomen, ma'am. Okay, so expose the abdomen while maintaining the patient privacy. Okay, so here are the 4 abdominal quadrants. So right upper quadrant, left upper quadrant, left lower quadrant, and right lower quadrant. So the organs here in the right upper quadrant are the gallbladder, right lobe of the liver, and head of the pancreas. For the left upper quadrant, the organs here are spleen, stomach, body of the pancreas. For left lower quadrant, the organs here are sigmoid colon and left ovary for female. So for right lower quadrant, organs here are right ovary and appendix. Okay, so now ma'am, I'm going to start the assessment by inspecting the skin, and the skin of the abdomen is normal. It is paler than the general skin, and there is no presence of abnormal colors such as yellow, redness, and blue. And there's also no presence of spider agioma, so that is a color red like may mga galamay, balamamhaw. And the skin is free from rashes and lesions, no abnormalities such as keloids, and I also noticed that there is no stretch marks in the abdomen of the patient. Next, let's inspect the umbilicus. Okay, so I can see here that the umbilicus is in midline and the color of the umbilicus is normal. Next, inspection of the abdomen. So the contour of the abdomen is flat. Okay, it's flat and evenly rounded, and there is also no fluid accumulating. And for symmetry, ma'am, could you please raise your head for me? Okay. Okay, and okay na. Okay, and the abdomen, there's no bulge when head is raises. Okay, next for auscultation. So I'm going to auscultate the 4 quadrants for 5 minutes each, and I'm going to start at the right lower quadrant. So here, for 5 minutes. Okay, then 5 minutes for the right upper quadrant. 5 minutes for the left upper quadrant. And also 5 minutes for the left lower quadrant. Okay, so the normal vowel sound is the normal octave with 5 to 35 clicks, and the other types of vowel sounds are hypoactive with less than 5 sounds. Hyperactive is more than 35 sounds, and absent is no sounds heard after 5 minutes of auscultation. So next, the different sound that may be heard on auscultation are brutes, venous hum, and peritoneal friction rub. So brutes can be heard on abdominal aorta. So brutes can be heard on abdominal aorta. So here. And it can also be heard on renal artery. Also on iliac artery. And femoral artery. And for venous hum, it could be heard on the epigastric and epigastric area here. While the friction rub can be heard on the splenic area here. Okay. Next, percussion. So, okay, ma'am. So now I'm going to percuss all 4 quadrant in a up and down manner, and I'm going to start at the right lower quadrant. Okay. Okay, so now I'm going to measure your liver span. So midclavicular line and midsternal line. So this is the midclavicular line, and this is the midsternal line. So so um, just below the umbilicus is just below the umbilicus. So I'm going to measure I'm going to measure, ma'am. So I'm going to start palpating. Okay. Kasi sakit na, ma'am. Lang ko. Okay, so here, pwede mo kapitan, ma'am. Here, okay, and okay, and the other one here. Okay. Okay, and I'm going to measure. So it is about 6 centimeter for now let's pwede mo yan. Okay, next for the midsternal line. So for midsternal line, okay, so can you note here, ma'am? Hindi, ari lang yung sa akin. Okay, and midsternal line. Okay, here. And it is about 8 centimeter. Okay. So, sorry. So, the measure of your liver, ma'am, is at normal. Next, I'm going to percuss your spleen. So, okay. Okay, ma'am. Now, okay, ma'am. So, now let's percuss your kidney using kidney punch. Okay, so, pwede lang tapong ko, ma'am. Okay. And let's expose your back. Okay na, okay na. Okay, and let's expose your back. Kapitin na, piyak ako. Okay, so I'm going to place, sit straight there. Okay, so here, at the, costovertebral, so I'm going to place, my hand here, and I'm going to, gently punch. So, there should be, no tenderness. Okay, so I'm going to punch my hand. Okay, and I'm also going to repeat the same process on the left side, slightly lower. Kung sa right naman, medyo taas, and kung sa lower, medyo nubo. Okay, so I'm going to punch, mama. Okay. Okay, okay, okay. Yeah. Okay. Okay, and during the procedure, there is no tenderness, which is a good sign. Okay, so next, ma'am, I'm going to palpate. So first, I'm going to use. Okay, next, ma'am, I'm going to palpate, and there are 2 palpations. So light palpation. So and this is used to detect for areas of tenderness and superficial masses. And I'm going to palpate the 4th quadrant for tenderness and masses. Okay, so let's expose this again, ma'am. Okay, and let's palpate. Light palpation. Okay. Okay, so upon palpating, wala man kami na palpate na bulging or masses. Ma'am, no? Okay, next for deep palpation. So this is used to detect masses and size of the organs. So we were advised not to use or perform deep palpation during the assessment but rather identify the areas and the proper placement of the hand. So for liver, for liver palpation, right hand parallel to right costal margin at the 11th to 12th rib. So 12, 11, 12. So here, parallel. And then we ask the client to breathe deeply and press upward. And for spleen naman, we place left hand under the client posterior lower ribs, and then we push up. Okay, so here under the client posterior rib, and then push up. Inhale, and then we ask also the client to inhale, and then we push upward. And normally, the liver and the spleen is not palpable. Okay. Okay, ma'am. So we're done with assessment of your gastrointestinal. So, do you need anything else, ma'am, before I leave?
No.
Okay. So thank you so much, ma'am, for your cooperation, and have a great day.